Okay, fantastic. Hello, everyone. Can you hear me? Yeah. Hello, everyone. Thank you for joining this panel discussion titled Partnerships Save Lives, Co-Creating Sustainability, hosted by Bayer. I'm Passant Al-Khatib, Access to Medicine Community Lead, Global Health Unit, Bayer Pharma. The global landscape is marked by significant disparities in access to healthcare. Access to quality care and gender equity are key indicators for sustainable and social development. Creating solutions that are innovative and collaborative and creating partnerships across the entire healthcare ecosystem are essential. In this panel, we're gonna talk about the role and impact of partnerships, as well as address some of the key barriers that exist in the race towards sustainable development. With that, I welcome my esteemed panelists. Jayashree Iyer, CEO of the Access to Medicine Foundation. Maria Rosa Coutillo, Chief Private Sector and Civil Society Branch, UNFPA. Michael Sharp, Deputy Director, Foundation Strategy, Gates Foundation. Bernadette Abella, Team Leader, Control of NTDs, WHO. And Klaus Runge, Chief Health Equity Officer at Bayer. Klaus, I direct the first question to you. Bayer is driven by its mission, Health for All and Hunger for None. Over the past few years, Bayer has been significantly increasing its focus on ESG and health equity. How has Bayer's ambitious ESG agenda evolved, and how do you measure success?
Yeah, thank you, Passant, and esteemed co-panelists. I'm very glad that you joined today's discussion. Also, a warm welcome to all of you. It's a really warm welcome, we have noticed. So we have asked housekeeping to see whether we can dim down the temperature a bit. So unfortunately, we cannot open the windows. Otherwise, it would be a super public discussion here. So, but I'm glad you made it. Coming back to your question, Passant, and I want to go back a bit, a couple of years. So back in 2019, Bayer has embarked on a pretty ambitious journey in defining its ESG goals. And of course, first and foremost, as an industry player, we have set ourselves ambitious decarbonization targets. That's not the topic we will be discussing today, but the second part, of course, is that we, in our respective businesses, have embarked on, a challenge to make our products accessible to more patients, consumers, and customers. So, as you know, we are in different businesses as Bayer. It's actually food or agriculture and health. I think the pandemic has shown that these are two vital components for human life on Earth. So food security and access to good health, healthcare and health products. In the agricultural division, we have pledged to help 100 million smallholder farmers to improve their livelihood with products and services in low and middle income countries, where smallholders make up to 70 or 80% of the food production. In consumer health, we committed to help 100 million consumers to get access to OTC products, especially in the area of nutritionals and also other products. And in the pharmaceuticals division, where I'm actually working, we have committed to enable 100 million women in low and middle income countries to get access to modern contraception by 2030. And it's important to state that this is an annual number, not a cumulative number. So by 2030, or in 2030, we want to reach 100 million women to make choices in their lives as to what kind of contraception they would like to use. That's our main goal on the pharmaceuticals division. We have now in the run-up to today, to 2024, also adapted our organization to meet these challenges. In the pharmaceuticals division, we have just founded a unit which is called Global Health Unit. It's supposed to be a social business where we actually further accelerate access of patients to our products across the portfolio. And if you think about it as a house, in the house you have different rooms. The one is, of course, the gender equity part that I just referred to. So we want to make modern contraception accessible to 100 million women by 2030. Secondly, it's work on NCDs. So we have a lot of initiatives that we can talk to later in the space of NCDs, also an increasing challenge in a lot of low and middle income countries. We have kickstarted some work also in oncology, also a big burden of disease for around the globe. And finally, we, of course, as a long-standing partner to the WHO, continue to support the aim to eradicate neglected tropical diseases. So that's kind of the setup. And with this, as you know, we can only achieve in good partnerships and in great networks with relevant institutions, some of them being here, partnering with us, some of them for decades already. And I think it's encouraging to see how these partnerships have evolved over time and how we've been able to expand reach to products, services, information for consumers and patients alike. So thank you.
Thank you, Klaus. We're going to get to the 100 million women goal and the GHU establishment, and we want to know more about it. Maria Rosa, the UNFPA is driving significant impact in promoting gender equality and women empowerment by ensuring right and choice for all. Why is gender equity important, and what kind of impact does investment in family planning bring? And what is the role of partnerships in driving this impact forward?
Thank you, Passant, and thank you for having us here. Well, it's a very simple answer, simple but complex at the same time. So gender equity is a human right. We have to see it in the human rights perspective. There's no other way to see gender equity. And of course, for UNFPA, the United Nations Population Fund, it is part of our DNA. Our mandate is around what we call the 3 transformative results: zero unmet need for family planning, zero preventable maternal deaths, zero gender-based violence and harmful practices. And so whenever we look across our 3 transformative results, we look with the lens, of course, of gender equality, no? And if you think about that really deeply, you understand that it's the prerequisite for a sustainable and durable development in societies. Investing, for example, in family planning, $1 will return $3 to a society, let's say in bigger pictures. So this is something that for us is key, and we really want to make sure that we get the right message here. And again, it's a human right. Family planning is, of course, part of it. It's, again, DNA in women's empowerment, in women's equality. If a woman is not able to choose with whom, when to have a child, well, there are at least half of the world that remains without choices. In 2021, we usually have a yearly report, which is called the State of the World Population Report. And in 2021, the figure we gave was, I think, 55% women in the world can make choices, but there is another 45 that cannot make choices. So again, talking about figures, today, nearly 257 million women worldwide, mostly in low and middle income countries, do not have access to modern contraception. So when Klaus talks about the 100 million women the buyer wants to achieve, that gives you the importance of working together. That gives you the importance, the sense of why we need to partner. The commitment that Klaus was mentioning actually was announced at a very important event in 2019, where UNFPA, together with its partners, celebrated the 25th anniversary of the International Conference on Population and Development. The International Conference on Population and Development, among other things, puts sexual and reproductive rights at the center of development, but as human rights, as fundamental rights. And there was a revolutionary step. So in 2019, many stakeholders came together, and now I come to the last part of your question. Many stakeholders came together, public, private, to commit to somehow fill the gap. And I think it's interesting, again, because quoting figures sometimes helps now. It's interesting again to recall what the gap is to achieve the 3 zeros that I was mentioning to you at the beginning. We say that it's about $264 billion from here to 2030. We need $264 billion to achieve those 3 transformative results. We have almost 42 billion. And again, and because this is something we keep on talking about these days, if you look at the present military expense, in 2023, was $2.44 trillion. So it's an enormous, let's say, gap between what is needed to ensure access, universal access to the 3 zeros. Zero unmet need for family planning, zero preventable maternal deaths, zero gender-based violence. We only have 42 million. We need to work together, 42 billion. We need to work together with many partners. And if you look at the big expense, enormous expense in arms and weapons, that seems like really an achievable result, no? So we need ecosystems of partners where we put together public, private, academia. And so I think the discussions we're having today are exactly in that direction. Thank you.
Well, thank you so much, Maria Rosa, for also providing these figures because they make it quite real and tangible. With that, I move to Maike. The Gates Foundation is committed to fighting the greatest inequities. Considering the Foundation's partnerships with Bayer, how has co-creating sustainable solutions to serve the underserved moved the needle on health equity?
Thank you. Yeah, so I'm sitting here representing our gender equality division that includes our work on women's health innovations, maternal health, and then also family planning. So I'm going to talk a lot about our family planning work today. And the truth is, I want to bring it to back to some of the positive strides that we have made, which is if you look at women's health, we've actually had a lot of success over the last years on the research, demand, and access front. And almost all of that has been due to partnerships. And so thanks to the combined efforts of governments, philanthropic organizations, the commercial sector, civil society, and scientific partner, via primarily the Family Planning 2020 platform, contraceptive use has never been higher. And in fact, since 2012, when FP 2020, which has now been renamed FP 2030, was launched, globally nearly 100 million more women and adolescent girls are using contraception. So it's also great to remember, what are some of the strides we have made? Some of those strides are due to the progress we've made in bringing new contraceptive tools into the market and the abilities to countries to expand their contraceptive methods. So, for example, long-acting reversible contraceptives have become much more accessible and affordable in all parts of the world, not just in high-income countries. Additionally, and so implants, for example, have become the method of choice in much of Africa, and a lot of it is due to partnerships such as the one with Bayer. Additionally, DMPASC, which is an injectable contraceptive method, has been introduced, piloted, and rolled out in 45 countries and allows women to self-inject, which makes it so much easier to overcome some of the stigmatization and the social hurdles that are sometimes introduced with family planning methods. But that's just a start. So in partnership with Bayer and others, like UNFPA, the foundation is developing more women's health innovations and wants to bring them to the countries where they are needed the most. For example, working on non-hormonal contraceptives. Why? Because we know that contraceptive options are saving lives. They transform lives, and they drive socioeconomic growth, as Maria Rosa was already saying. And if you want to remember one thing from this entire panel, then it is that investments in women's health pay off. They pay back and they pay forward because if we invest in women, we invest in families, we invest in communities, and we invest in societies. It also pays to partner. And so as we think about increasing cost of living, conflict, climate change, and all the other crises, no one of us can achieve this alone, and we need to work together in achieving some of these ambitious goals. So last year, one example was that we launched an initiative called the Innovation Equity Forum that brought together more than 250 stakeholders in women's health R&D in order to think about what are the most important opportunities we need to make progress on. And we released a document called the Women's Health Innovation Opportunity Map together with NIH, so the US NIH, to bring out what are these opportunities and how can everybody contribute to improving the health of women. In addition, the World Economic Forum launched a global alliance for women's health in order to bring together stakeholders across all sectors to work towards the health of women. And then last month, during the UN General Assembly, we announced that we are partnering with the European Union to strengthening financing mechanisms that will accelerate access to health products, including safe, effective, and affordable contraceptives. And this includes a lot of our work with UNFPA supplies, for example. And so that partnership that's really been important in bringing contraceptives to the women who need it most. The foundation has made a 75 million catalytic investment in UNFP supplies, but we need others to stand up and also contribute because these are good investments and strong investments. And at the end of the day, women themselves are our ultimate partners. When we think about the public, the private, the philanthropic sector, at the end of the day, it's all about the women who need to have the agency and the power to actually make their own choices about their health. And that includes fundamental decisions about their own lives. And if they are able to do that, we'll see healthier, more productive, and more resilient economies and societies. Thank you.
Thank you, Maike, and thank you also for highlighting that it's an investment. We're going to dive into how to scale up these progress that you have mentioned in the later sessions. Bernadette, the WHO champions health and a better future for all and plays a crucial role in addressing global health challenges through partnerships. Bayer has been proudly partnering with the WHO to eliminate NTDs for around 25 years now. How is this long-standing partnership contributing to meeting the needs of underserved communities?
Thank you very much, and it's a pleasure to be here with you all today. I love the title of this session, co-creating. We have been co-creating together in multiple partnerships, private, public, with you in the room, multiple people working with us actively in research, development, civil society. This is how we get the word out. This is how we do our work. And of course, it's a right to have access to health. And so this is how we work in order to reach the marginalized people. For those who don't know neglected tropical diseases, it's really a way of reaching the neglected populations and giving them access to health. And we have 21 such diseases that we qualify as neglected tropical diseases. In the beginning, we focused perhaps on 7, the preventive chemotherapy diseases. And over the years, there has been much more support from the partnerships to actually look at trying to also make progress on the others, perhaps seen as more complicated, but really we can make a difference. So over the years, with pharmaceutical companies like Bayer, Sanofi, Merck, and I'm not going to mention them all, we have 13 pharmaceutical companies, 1 diagnostic company, and then of course a myriad of development partners who are interested in also seeing this progress and seeing that this progress towards neglected tropical diseases actually contributes to development. Countries have signed up to the Sustainable Development Goals, and their contribution is actually moving this portfolio forward, because in 2030, when we sort of look back and see what we have done, we will have a signature in there as well. So over the years, we have delivered 30 billion medicines. That's a Herculean task to reach, these children, these women, people in conflict areas, in rural areas, where often it's a long way to a primary healthcare station. So we have, with the help from our partners, received donations, received unlimited supplies, but also support for operations. And donation is not just about a medicine given to a child. It's really starting a whole clockwork of other things, we start to understand the epidemiology. We build the workforce. The workforce we saw in COVID is not only working on NTDs, it's a movable. We reprogram our workforce. And so the more they are given capacity and empowered, the more they can handle other situations. So working on NTDs builds those health systems. And as we've moved forward, and over the years, many countries have seen the elimination of multiple diseases. Lymphatic filariasis in multiple countries, trachoma. HAT, for example, the African trypanosomiasis, we only have a few hundred cases left. So we are making progress. It's slow. We still need to work together very closely, commit. We are all accountable because in a safer world, we can also avoid the repercussions of poverty and slow development. It affects us all. So we all have a role to play. And as we move forward, we will improve health together, development, and that human right aspect that we all have an ethical obligation towards in reaching the people who are the most underserved. Thank you.
Thank you, Bernadette. Again, the human right element keeps coming up. Jay, for around 20 years, the Access to Medicine Foundation has been researching the world's largest pharmaceutical companies' actions on access and influencing the industry to do even more. How does the foundation identify the most critical opportunities to advance access in underserved communities, particularly in low and middle income countries?
Yeah, so thanks again for the invitation. And I'm here in an independent capacity to kind of talk a bit about our work. So as Passant already mentioned, we've been around for almost 20 years. And in that time, we have tracked and monitored the actions of some of the largest pharmaceutical companies and how they're improving access to medicine in low and middle income countries. We use a multi-step model for change. The first step is in identifying the real needs. So we work with different communities, including patient organizations, practitioners, the World Health Organizations, governments, investors in pharmaceutical industry is also part of this whole analysis so that we can identify the most critical areas that the industry needs to focus on. And we do that across the industry, but also at the individual company level, like what do you expect from Bayer to achieve in the next couple of years versus the long-term expectations? What are the most valuable products that are most critically needed? What is happening in the past years with some of the partnerships? Are they successful? Do you want to see more? Do you want to see change? So using all of that, we transform these the needs into indicators, and using those indicators, we track progress made by the industry against those indicators. We score companies, and we develop a ranking every 2 years of how the companies perform against these indicators. Now, the work is not only a ranking, we also come up with a number of best practices on what is really working in the world as a way to stimulate other companies and other partners to partner up and create the kind of partnerships that we're talking about today. And most importantly, we utilize these findings with different circles to make sure that policy recommendations are also improved. So we work specifically with a number of high-income and low-income country governments to make sure that the investments they're putting forward, the policies they're putting forward, is creating sort of a responsible platform for access in low and middle-income countries. But importantly, we actually host the largest group of signatory investors. So these are institutional investors. These are some of the largest banks, pension funds in the world that invest in the pharmaceutical industry. And we've created a system where they can use our data to invest more responsibly in the pharmaceutical industry and understand what it takes to solve some of the problems in access. So currently we have over 140 investment firms, and that number has been growing in the last few years. A couple of weeks ago, in fact, we had a conversation between institutional investors and the pharmaceutical companies, like the access leaders in the pharmaceutical industry, coming together to talk about how do you embed health equity and access within your business itself. So we try to make sure that these kind of partnerships are fostered with data, with insights, with making sure the right connections are being made, and creating an accountability framework so that there is some momentum in the change. there's momentum against some of the commitments that are made by the pharmaceutical industry, in the sense that they report into our system and we publish whether it worked or it's not working in that sense. So that's primarily how we do our work. In a couple of weeks, we will have the next Access to Medicine Index published on the 19th of November, and that will show sort of the recent developments in the pharmaceutical industry. And beyond the big pharma companies, we also work with some of the largest generic medicine manufacturers, a small group of medical oxygen manufacturers that are responsible for the world's supply of medical oxygen, a number of vaccine manufacturers, and on thematic areas such as diabetes care and drug-resistant infections. Because at the end of it, you need organizations across the entire continuum of care that are producing different types of products in order to actually ensure access to medicine. Thanks.
Thank you, Jay. And we're going to dive into some of the critical success factors that can drive health equity forward in the next session, which we're going to start now with you, Klaus, when we're going to talk about the impact of partnerships. So from the 100 million women goal that you have mentioned and the establishment of the Global Health Unit at the beginning of this year, how does Bayer view its role in the ecosystem, and what unique value does Bayer bring? What are the main enablers to broaden patient reach and deepen impact?
Well, I think with the businesses we're in, as I mentioned, we're in very relevant sectors in food and health. And I think when I look at the family planning part in particular, I think what we can say is we've been on a journey from being a sheer supplier of product back in the 60s to a real, let's say, systemically relevant player in the family eco-planning system. What has happened along the way is that we're not just seeing our responsibility end at the gate of the factory, but that we can also inject our expertise around the products, around healthcare systems, ecosystems into partnerships. And I think over the years, a certain level of trust has evolved between us as partners. I mean, we have research partnerships with the Gates Foundation, for example, on new methods of contraception. It's an endless list of partnerships we have, and I think they are vital to be successful. So what can someone expect from us? It's actually that we will be continuing to supply enough product. Yeah, so we actually have just recently built a factory in Costa Rica to serve the needs of women in low and middle income countries with implants and intrauterine devices. So on the supply side, we've done the job. So the capacity is there. It just needs to be ordered. Yeah, we just need to be able to bring it to patients or to women in need, not patients. So that's one. Partnerships help us also to anchor programs in communities. Thinking about the Challenge Initiative as a large program that reaches more than 200 million individuals every year, who have then access to family planning services or sexual and reproductive health services. So that's probably also a good way of broadening the scope and the reach across the globe. If you think about some therapeutic areas, or for example NCDs, we also do a lot of capacity building. I think that's also vital. So one of the initiatives that we have built up over the years is called the Ghana Heart Initiative. It's proven to be very successful in not only training thousands of healthcare workers in the area of cardiovascular disease, but also it was kind of the starting point to develop and implement treatment guidelines for cardiovascular diseases in Ghana. NCDs, especially heart disease, is still on the rise in sub-Saharan Africa. So I think that's an important contribution to hold something up against it. And the program obviously has gained so much traction with our partners, GIZ and others, that the next step will be to open it up for additional partners. So some of our industry peers will be joining the initiative. It's subject of a discussion that will happen tomorrow between the CEOs. So we will bring in other companies on this platform and expand the scope beyond cardiovascular disease, or deepening also the scope within cardiovascular disease. So I think it's also important for us as industry to partner with our peers on these programs. Yeah? Then there is other initiatives when it comes to cancer. So we have a lot of partnerships in the area of renal cancer, prostate cancer in countries like India, Egypt, Ghana again. So we are really trying to make these products way more accessible. And you have to keep in mind that some of the products we have seem to be old style or a bit older and maybe third or fourth line in developed nations such as Germany or others. But in countries where you don't have biomarker testing, et cetera, they even maybe first-line products. Yeah? So you have to make sure people know how to best use them. And then, of course, in the area of entities, again, partnerships are crucial. And what we can bring to the table is this muscle of being able to find assets who are potentially efficacious against some of the vectors or parasites that cause NTDs. So we have R&D programs. We're actually developing new medicines in the area of NTDs, although it's commercially irrelevant for us, obviously. So we have a phase 3 program that we just signed up. So it just moved into execution to treat some worm infections. The active ingredient is called imodepside. We're partnering with the Swiss Tropical and Public Health Institute and DNDi on this one. So it is all about partnerships. And the one thing I can tell you is it feels like you can do even way more every day. Day in, day out, you feel like, oh, isn't there anything else we can do? So it's a constant reevaluation of how impactful we can be. And with the Access to Medicines Foundation, I think we have a great, let's say, mirror that we can look into every now and then and say, are we on the right track? Who's doing better? Yeah, so it's a competitive area still, at least on the ranking. Yeah, it may not be commercially in some of the areas I discussed, but of course we're competitive and we want to perform. Yeah, and so it's so important to have also the ATM Foundation as a catalyst, yeah, to leverage this competitiveness and to help us and our investor base to understand what we're doing and how we can do even better. Because ultimately, it will help the business over the long run. I'm firmly convinced. So, coming back to your initial question, I think it's been great to experience this move from being present to being relevant as a company, and it comes with a certain responsibility that we actually gladly pick up with our partners and in our partnerships.
Thank you, Klaus. From presence to relevance. I really like that. Maria Rosa, given the successful partnerships between UNFPA and the private sector, including those with Bayer, can you share a specific example of how collaboration has led to the co-creation of sustainable solutions to tackle health and gender inequity? And what are the most effective strategies required to foster collaboration?
Thank you. And I want to really bring it back to the passionate, positive side of this conversation. We build partnerships with passion every day. Yeah. For the past 10 years, this office has been really reaching out and engaging the private sector, the corporate sector. We have seen how powerful the corporate sector can be. So what Klaus was saying, not only presence, but relevance, and how we can make an impact together. That's what really matters. When we think about the women and girls that we serve, that's our thought every day. Our dream is really to make a difference. Those figures were interesting at the beginning. They just give a sense. But of course, there's much that we're doing. There's a lot that we're doing together also with the Gates Foundation. And so maybe one example that comes to my mind, and because we're happily being invited by Bayer here today, is the work that we are doing in India. Mm-hmm. So it's not only about the product. It's also about the awareness. It's about the holistic approach in a recipe for a partnership, the holistic approach that you undertake. It's about clarity on roles and responsibilities. I am very frightened by the partnerships where everyone does everything and it ends up in a confusion. What we were able to do with Bayer, like with many other partners, is really to be clear that we are complementary. That what we do as a UN agency is different and complementary to what a corporate partner can do. Different than what a philanthropic partner can do. So I think that's the first ingredient in the recipe, being clear on roles and responsibilities and complementary. And that's what happened in India with a program that we call Just Ask. So when we partner with our corporate partners particularly, the philosophy we have is that we intersect our geographies. Of course, the corporate partner as a business interest and an impact interest. We are present in 150 countries, and we have specific needs that are specific to geographical areas. So for example, in India, one of the main needs is to involve particularly young population, girls, in awareness building on family planning, on what are the options. And so we started this idea with an AI implementing partner. We started this idea of the Just Ask, which is reaching thousands of girls and women between 15 and 29 years with information, with ways to somehow promote their access to family planning. And this goes back to what Bernadette was saying at the beginning, the idea of really leaving no one behind. Because a lot of these girls, a lot of these women are in remote communities. So without this type of partnership, they would be completely left behind. And we've seen that in many other cases. I just wanted to go back to the UNFPA supplies example that Micah was mentioning, and that's, I would say, a glorious partnership that we have with many other partners, but particularly with the Gates Foundation, that committed $100 million to the UNFPA Supplies Partnership. The UNFPA Supplies Partnership actually attracts resources precisely to leave no one behind with commodities, with sexual and reproductive health commodities, really reaching the last mile. And that's what is so important. We at the United Nations talk very much about this principle of leaving no one behind. It's a key in the Sustainable Development Goals. Sometimes we struggle to give it substance. And I think these partnerships actually give substance. I think you mentioned, Micah, some of the results, but this partnership, the UNFPA Supplies Partnership, since its beginning in 2007, has prevented, for example, 89 million unintended pregnancies, 26.8 million unsafe abortions. It's an immense, in relative terms, it's an immense impact. So that's why, going back to what we were saying at the beginning, what is really important is the impact that you make. It's not signing a partnership. Absolutely. It's great to announce a partnership. It's great to announce a partnership with Bayer, with Gates. We had commitments to UNFPA supplies during the General Assembly of, I think, $350 million from public and private. And the public were not only the donor countries, they were also the countries where supplies happens, so the programmatic countries, and that's very important. It's a sign of an awareness of the importance of sexual reproductive rights that is growing, no? So, you know, committing, announcing, making a very nice communication campaign around these partnerships is great. But at the end of the day, is the lives that you support, the lives that you change. So also with a partnership like this in India, you can imagine how many minds are positively influenced. And I think we have some testimonies really of girls that talk about their imagination. And now they are able at least to talk about these issues in an environment where, of course, the risk of stigma is very high. And like that, many other contexts. We were in Mexico in August with another corporate partner. How, for example, you talk about prevention of early pregnancies with a program that empowers you also economically on a boat outside Mexico City. So all these very creative ways, but these are creative ways that really, really allow us to make an impact. So let's say the summary answer to your question is really the importance of the impact that you make and measuring the impact that you make.
Yeah, absolutely. It's about the impact, but also I like the secret sauce that you mentioned at the beginning about the clarity of roles and responsibilities, that it needs to be complementary. With that, Mike, the Gates Foundation has been instrumental in fostering innovative partnerships in global health. What is the impact of multi-stakeholder partnerships in improving access and advancing gender equity, and how can this impact be scaled?
Yeah, I think Mariposa talked about some of the impacts. I think it really can't be underestimated how important the scaling aspect is. And we can help building partnerships, but we can't do it alone, and we definitely can't solve all the funding gaps, etc. And so we know that women can't do well if they can't be well. And so we see chronic underinvestment in women's health across all areas, whether it is research, whether it is contraceptive access, whether it's delivery of solutions. And that is actually not something that is only true for low and middle income countries. It is true for high income countries as well. I mean, we know that only about 4% or so of VC funding goes into women-specific conditions. And those are all gaps that we need to close in order to really make progress. But I do want to talk a little bit more about the family planning, and particularly the family planning funding, because we know that that's going to be a major unlock for economies, and we really need it in order to empower women all around the world to live their lives and live their lives in a healthy way. And the truth is that most of our challenges in delivering contraceptives are political. They are not technical. We have a lot of the solutions that we need. And so women's reproductive health is just not prioritized in the way that it should be. And the dollars that are needed for women's health are not keeping up with the needs, and that's across the entire chain. So one large goal of our family planning strategy is to amplify the investment case and talk to all stakeholders about why it makes sense to invest into women's health, why it makes sense to invest into family planning, and by demonstrating the potential for impact on women's lives. Specifically, we're right now doing that by trying to enhance commodity availability in 6 geographies where that's been difficult across sub-Saharan Africa and Asia, and then showing what a difference that can make by working with women in Nigeria, in Ethiopia, in Senegal, in Pakistan, in Cote d'Ivoire, and Niger in particular. Partnerships are key for this financing to driving the progress in the near and in the long term. And Klaus talked about some of the industry partnerships. And I'm actually, one of the things I always find really encouraging, particularly in the women's health space, is how much it seems that industry is coming together. And there is a willingness to collaborate and to work together and think through how to overcome some of the challenges that we are seeing. One of the partnerships we are currently working on is called Leaders in Reproductive Health. And this is actually going to model something that's been very successful in climate, which is called the Climate Leadership Initiative, which raised $3.4 billion US from high net worth individuals. So if anybody has money lying around, we can tell you where to put it. We are co-funding this initiative with SIF, Hewlett-Packard, and others, and we'll try to channel funds to a list of high-impact projects, because oftentimes there are people who are willing to put money into priorities, but they don't know where to start, particularly when it comes to global health. We also aim to replicate some of the country compacts, because I think it's really important that the countries have a skin in the game. And so one example that was recently very successful was in Ethiopia, which contributed $17.5 million itself to close their commodity gaps last year, because they wanted to make sure that the women in the country had access to contraceptive methods. So through these and other partnerships, we actually hope to raise 300 to 600 million in new and better funding for family planning that supports others to scale commodity access and additional approaches in our focus geographies. Because we know that investing in healthy women is truly the best investments that both governments and private sector and philanthropists can make in order to improve societies and economies.
I like that closing remark. So it's really effective. But I also like when you said women can't do well if they can't be well, and it's very simple but very telling as well. Bernadette, you had mentioned HAT, or African sleeping sickness, was one of the first diseases to be eliminated as a global public health problem in 2022. And meaningful progress has been made toward fighting Chagas disease. What are the key success factors, and what lessons can be drawn from these achievements to develop future collaborations and ensure sustainable outcomes? How has the dynamic evolved to shift the focus from fighting to eliminating NTDs?
Thank you very much, Prasad. I think one of the big shifts is that countries are at the center and communities are empowered. And many of the communities have now an increased knowledge on what they can do to change the situation. Over the last 24 years, we've seen a drop from 30,000 cases to a few hundred. And that's due to the partnership, the support from Bayer. We receive and support countries in the reception of 15 million tablets over the last 22 or so years, and 250,000 ampules of ceramine. We have also multiple millions dollar support for these programs, and I'm not saying this goes to WHO. This is actually for the operations and support of supply chains to get those medicines and care. So it's not just the medicine, it's really the care, the preventive. And I guess what has changed as we move forward and prevalence drops, then often it drops also in the sight of our policymakers. And so we really have also a role to keep vigilant around these type of diseases that could also reemerge in the future. But we have made true progress both in human African trypanosomiasis, that's the Gambiensis one, with Chagas, which is not only a problem in Latin America, it is an international global problem with blood donations and things like this, where we've become more vigilant. And so keeping or reducing the burden of Chagas has an impact on all of us. But also recently, in 2002, Bayer also started supporting, as a leader, a new neglected tropical disease, that's Taenia solium, which causes neurocysticercosis and epilepsy and seizures in people, and have been really a catalytic partner to actually start a program where there's a lot of work needed. A new program needs to, build demand, give people, the communities, confidence in the health system that when they go to the health system, they're going to receive health care. And so we have been working very, very closely with our partners, both on the delivery of medicines, but also on the capacity building. And again, this is a recurring theme. The more we can build our workforce, the more capacitated they are to do other things and support the health system strengthening. So I think something came up before about competition. I think what it has shown us is among partners, sometimes we like to compete. It's not always very beneficial. I mean, there's a good amount of it, but I think the collaboration and cooperation that we have built over the years is unique, is very powerful. And when it works, it can move mountains. And I think one of the things coming out of here is really, okay, competition's good, but I think we must learn to collaborate more, to cooperate. So we're not thinking about only our individual benefits, but really about the global good and the bigger outcomes of our work together. Thank you.
Yeah, thank you, Bernadette. And maintaining the work so that the so that the progress is also maintained. Jay, with around 80% of the world population living in LMICs and billions of people, especially those living in LMICs, still not being able to access the medicines that they need, what are some of the best practices and critical success factors that lead to change in advancing global health?
Yeah, thanks for the question. And in a couple of weeks from now, when the next index is out, you'll see some fresh new data. But I thought I'll take some highlights from the last couple of years to kind of illustrate the point now. I think we've already heard about the excellent partnership on women's health and contraceptives. So that has been an example that we've also highlighted, explaining also why this is important and why these are the kind of partnerships that need to be sustained. Because as Maria Rosa mentioned earlier, it's not about just the announcement of the partnership, but it's the progressive results that make the difference between a good partnership and otherwise. And I think Bernadette's already spoken about how 13 companies come together to supply products for neglected tropical diseases, and many of them are also part of the innovation cycle to come up with new products, working with partners to develop that, because you need next generation products for some of the neglected tropical diseases. So those are quite a few classic examples that are really making a difference, and we're hoping to make sure that the companies involved in these type of partnerships continue those efforts, and more companies who may not always have all the resources or the footprint in some of these geographies to make a difference would find partnerships like this or work with these partnerships and build from that point itself and deliver more. There's been a couple of other examples that I'd like to talk about. So there's an example where there's a partnership with Innovations in Healthcare, which is an organization, and a company like Takeda partners with them. And they've managed to develop a sort of an access to impact framework. And they've created a framework which helps to kind of support sort of live adaptations for real-time developments in partnerships to ensure that the access programs are actually working. And hopefully these type of frameworks actually help a company and their partners understand if the impact is actually being made, and build in sort of an inbuilt accountability system in the partnership itself. There's also an example where there's a number of companies where they partner together, so where collaboration makes a bit of a difference. So GlaxoSmithKline and Novartis, they actually partner together, and they've created an initiative called Gradient, and that's intended to sort of build R&D capacities in low and middle income countries, so that more capacity for running studies, co-creating and co-designing some of the products that are in development, so that they're not developed only at headquarters or with partners in high-income countries, but they're really working with partnerships in countries itself, and that helps increase clinical trial capacity and eventually better access in the regions where these studies are being done. And that's an important point, because at the end, it's not only about products that are already on the market, but it's about what is happening with future products from companies like Bayer, like some of the other companies that we've mentioned today. Are those products actually going to be made available in low-income countries itself? So there's a couple of examples on access planning. What do you mean? What is early access planning? To prepare for registration in countries, prepare for supply commitments, working with local partners to make sure that the capacity, the absorption power, the guidelines are all improved, so that when a product is launched, it can be used immediately by populations. That are a few of the important best practices. Another important best practices, which we'll report in a few weeks about whether it's picked up enough in traction, is really a lot of pharmaceutical companies don't necessarily have the footprint in many of the global markets. So utilization of mechanisms like voluntary licensing is really important to get that scale of access. And for a lot of occasions, also making sure that the price is affordable in different regions. So it helps in availability across the world and in affordability, especially when products, the prices of these products need to be brought down to more affordable levels. And obviously, voluntary licensing is a partnership which has provided a large number of treatments for HIV patients, for recently for more preventative products, and for hepatitis C, and we're hoping to see more for cancer care and other NCDs where a mechanism does exist but needs to be utilized in a lot more capacity. Now, in the voluntary licensing arrangements, most of us in the news, we tend to just see it at the point of the announcement. But what's happening behind the scenes is really that tech transfer agreements to make sure that the product is being made at scale, at quality, to meet the demands in the world. And in the meantime, the patent holder actually continues to supply until the point of that supply is actually in place itself. And that requires a very careful partnership to make sure that there's no gaps in access itself. So there are a number of different voluntary licensing based partnerships that we've also highlighted in our work. And I think lastly, I just want to talk about how, there's a number of different examples that we've also highlighted in a recent patient reach report. And there we've got 7 recommendations and a couple of examples of how do you tackle recommendations in real life itself, so that company commitments are really matching the need in the world itself. Take the example of the family planning initiative that we just spoke about, right? So the initiative has quite broad ambitions in terms of a number of women they want to reach with this particular partnership. But at the end, a woman needs choices. A woman needs multiple options in front of her in order for her to understand which circumstance situation actually works. So we're hoping that more companies who are working in contraceptive care, or those who are considering leaving contraceptive care and do need to prioritize it back again, because it is important to come back on board and make the sizable commitments that Bayer is making, so that overall you're actually reaching all the women who need care at the same time. In our patient reach report, we took an example of a non-communicable disease like diabetes care, and we demonstrated that all the commitments combined only reach about 1% of people living with diabetes. So, you need the size of the commitments to become bigger, but you also need to make sure that there's a way to reach these people all around the world and keep that consistently in place long term itself. So we're on the lookout for sustainable practices, and we'll report a few examples in the next index in 3 weeks from now.
Thank you, Jay. So it's about embedding access as part of the core strategy so that the patients are actually reached with the medications that they need.
Right.
As per the WHO and the World Bank report that came out, half of the world population still lacks access to healthcare services. In the last part of this panel, we're going to delve into some of the gaps and the barriers that stand in the way of systemically removing barriers to care and what can be done to overcome them. So with you, Klaus, as a company deeply committed to serving the underserved by fostering inclusive growth, what are some of the most significant gaps impeding systemic removal of barriers to care, especially in LMICs?
Yeah, thank you, Passant, for opening up the third round. So I think in some of the areas, in particular when you think about purchase of or procurement of commodities, of course, it's donor funded to a large extent. And we've seen a COVID dip in terms of funding for commodities. Yeah? So that's been hitting us. So our initial plans back in 2019 have been a little more ambitious than the ones we currently have. At least what we need to plan for is an acceleration now, because we have seen this dip and we only recovered slowly. So that's a big issue. The second one, and I mean, adding to this is I saw a cover of The Economist on my way to Berlin yesterday when I was on a train, and it said European leaders seem to be in the headlight of the US election like deers on the street. Yeah. So, and I mean, there is some truth in it. Yeah. So we also need to figure out what's going to happen if we see a change in the US administrations, and how does it trickle down in terms of availability of funds for some of the activities we have. So. And then the question will be, how do we compensate? How do we find mechanisms to overcome some of the potential funding issues that could surface downstream? So that's I think something we have to keep an eye on, and we have to be very agile in a response, and we shouldn't show up as deers in headlights standing on the street. So. There is other hurdles purely from a perspective of a pharmaceutical company. Oftentimes procurement is preferred when you have local production. Yeah, so of course we cannot we cannot produce everywhere. So although post-pandemic we've seen a sharp trend towards verticalization. Yeah? So I'm afraid I think this will lead to a generation which will be less wealthy. So if we give up the globalization successes that we have seen, all the funds and money that we need to invest into verticalization efforts will not be available for innovation. Yeah? So you see it also in the US-China conflict. It's really a challenge also for our industry. So, but where we can, we try to do our best to also localize manufacturing. So recently been to Sub-Saharan Africa because we want to bring production of an oral contraceptive to Sub-Saharan Africa. So I hope that as of the middle of next year, we will be going live, yeah, so with our partners. Then in the NTD space, I just traveled to LATAM recently. Again, we talk about full technology transfers to empower governments to also produce NTD products on their own. In this case, it's a Chagas product. So we're trying our best, and this is actually something where the Access to Medicines Foundation invited us to consider to become better when it comes to localization. We haven't done a good job in this regard in the past. So, but these are, let's say, first responses to change that footprint and to then potentially reach even more patients in need. We also have to acknowledge that in many legacies and geographies, we have a lack of infrastructure. So the question always is, what can digital add? Yeah, and I mean, it's like phoenix out of the ashes. Everyone thinks like digital can do everything. That's probably too far-fetched, but with the programs we have in India with UNFPA, we see that if you think it through, if you have the right approach, and the first numbers are really impressive, you can reach people. We have other partners in Africa with Zuri Health. They are also here at the conference, where we help people find the infrastructure they need to get treatment or services. Yeah, so that's an important point. It's a bit of, let's say, not only offering services, but also helping people orient in their respective country where they find a good gynecologist or someone who they could counsel. So that's another area. Another barrier that we often have are social and cultural norms, especially in family planning. So last December, I've been to an informal settlement in a city 2-3 hours out of Delhi, and I mean the living conditions are really awful. And you have one physician serving 70,000 inhabitants with everything. Yeah, from vaccination to cardiology, treating cardiac diseases. But I mean, if you then talk to the women who also go there for counseling, you notice that you need to have these choices. Yeah, also the various commodities in place. So I talked to a woman and she said, I only want to have an injection with all the hormones for contraception because I cannot hide the pill at home. I cannot hide the box at home. If I have an intrauterine device, my husband could notice during sexual intercourse. So the one thing I want to have is a shot every 3 or 6 months, depending on the product, because that helps me manage my life and helps me spacing between delivery of kids. Yeah. So I think that's also something that we as an industry partner had to learn, probably also others. It's not just about dumping a product, it's about offering choices. Yeah, and that's where we try to contribute.
Yeah, offering choices that also put the local communities at the center. So Maria Rosa, as UNFPA continues to drive initiatives for health and gender equity, what are the gaps that hinder sustainable progress in current partnerships, and what approaches are necessary to bridge these gaps?
So I'll just probably pick up from where Klaus left. So, well, the general gap that we see overall is we see commitments, but we don't see often these commitments translated into policies at all levels. So women's health has to be something intrinsic. And lately, we particularly looked at the workplace. No? So in our explorations with many partners in the past few years, particularly corporate partners, one thing became empirically very evident. Not only these partners were interested in partnering with us to make an impact in communities, but we had a chance to work with them, to influence them, also in somehow having a larger, stronger engagement, particularly on sexual and reproductive rights in the workplace. So there was a lot being done, but there was a big gap, and there is a big gap in measuring and taking a picture of what exactly is sexual reproductive rights in the workplace. And you know, very simply, the environmental, social, and governance indicators that somehow influence all the protocols that then companies follow to report on their sustainability or corporate social responsibility activities, they don't give a picture of sexual and reproductive rights. So we commissioned a research to see whether that gap was really existing. The gap was more in the wording. Many companies were doing things. Many companies were doing things on parental leave. Companies were doing things on prevention of gender-based violence and support for domestic violence. But not a lot of companies, until a couple of years ago, were doing things specifically on menopause, for example, discussing about menopause in the workplace, tackling the stigma around menopause, menstrual programs, but like really organic menstrual programs where you have awareness building, etc., leave and other measures. Fertility, awareness building on sexual and reproductive rights, and not only for women in the workplace, but having men, colleagues involved. It required and it requires a cultural change. So that became extremely evident, and so that became another passionate adventure that we started. And we started it in 2022 when we launched with other UN agencies, with other corporate partners, centers of research, a coalition, which we called a Coalition on Reproductive Justice in Business. We were passionate by the idea that working on this, we could reach millions of women. If you think about women in global supply chains, you think about almost 200 million women. And in many, many contexts, women who don't have access to choices in the workplace. So the corporate sector particularly has an enormous power, an enormous potential to somehow fill that gap. Not only it is a matter of implementing in the workplace, but it's a matter also of financing the sexual and reproductive rights agenda. If you think about that, women are 40%, more than 40% of the global workforce. They spend between 40 and 60% of their lifetime in a workplace. That workplace, if we think about filling gaps, if we think about really mainstreaming and going beyond commitments, the workplace becomes a key place. We've been talking about women empowerment in the workplace. I'm all for it. I'm all for women's leadership in the workplace. But we don't have to forget the rest of the women who don't perhaps reach leading positions, but still are the major force in a workplace. So this initiative is an initiative that we had launched specifically to look at that gap. We have seen, and I've got some figures here, that if a company invests in sexual and reproductive rights in the workplace, you have a 62% reduction in absenteeism, a 62%. There's an increase in attraction of good talent that wants to remain in a company, that is almost 46%. You create a world which is different, important, meaningful, and relevant for women and men in the workplace. So we started with that. We worked with Accenture to develop something, a tool that would speak the language of the corporate sector particularly. and would look at indicators. What are the indicators that somehow, going back to what was said before, that somehow speak to a corporate around measuring sexual and reproductive rights in the workplace? What is it that you need to measure? So we identified 6 areas. You can find them on our website, on UNFPA's website in the section dedicated to the Coalition on Reproductive Justice in Business. 6 areas in which companies can experiment and they can work together with us to somehow mainstream these indicators. There are 30 indicators, a policy paper. It's a policy paper that's for which, of course, we need the support of the private sector, but we also need the support of policymakers. So we've started getting interest from some countries who are willing to work with us and the private sector and create that virtuous circle that somehow can help mainstream these indicators. And I'm happy to say that we're working on those also with Bayer, specifically on one area that we will announce soon.
Fantastic. And also the part that you mentioned, including the men also in the conversation, is very important. Micah, the Gates Foundation has established many impactful partnerships aimed at improving global health and improving outcomes and serving millions of people, especially in LMICs. What key barriers are there? How can we reach even more patients?
I feel like we heard a lot about barriers already from Klaus and Maria Rosa, so I might try to talk about opportunities instead. I talked a lot about funding earlier, and I do think there is a real opportunity to spend more on women's health across all areas. But I also want to talk about some of the other areas. And so early on, I mentioned it's like Women's Health Innovation Opportunity Map that we brought together to really talk about what are the barriers. And so when we looked at the opportunities around the cross-cutting areas that would be needed to get to better women's health innovations, the sad thing on the one hand is it is across the entire value chain. The good news is also there's a lot of small steps that can be taken to make real improvements. For example, look at data and modeling. For a lot of conditions that affect women, we know that they are systematically underestimated in things like the Global Burden of Disease studies that is used by a lot of companies and countries to actually drive what they're investing into. An example for that are STIs, sexually transmitted infections, where we know that usually the burden is only counted for the acute instance of the STI, but not all the sequelae and all the impact on, for example, fertility that might actually impact women and men throughout their entire lives. Research design and methodologies. In the US, for example, until 1993, you didn't have to include women or any other populations outside of white men in a clinical trial in order to get a drug into market. So think about all the drugs that have been in the market since before 1993 and think about how much data we are missing on whether or not they're actually safe for some of the populations. And luckily, we have a lot of post-marketing surveillance data now that hopefully avoids some of that. Regulatory and science policy. One of the gaps we often hear from industry, or the challenges we often hear from industry, is nobody wants to do clinical trials in pregnant women because there's the fear of liability, there's the fear of litigation, et cetera. But it also doesn't help if that means that we don't know whether or not, for example, COVID vaccines have the same effect in pregnant women. And we had a lot of delay in getting some of the most vulnerable populations access to the treatments that could save their lives and the lives of their babies because we don't have the right regulatory processes to make it possible to have those studies in a safe way. Innovation introduction, thinking about data repositories, about actually knowing what is needed. One of the things we hear a lot from industry is if we want to go to low and middle income countries, we need to know what the demand is for certain products, because otherwise, if we don't have sustainable demand, it doesn't make sense to build up manufacturing capacity and then nobody buys the products. So getting into market shaping mechanisms that can help, and for example, in the vaccine space, there's been a lot of really exciting movements just by helping create mechanisms that help companies understand better how many vaccines are going to be bought in a single year. And I think we can learn a lot of that for other places. And then the last two, social and structural determinants, and you already brought that up. And what I will say is bring the right voices to the right discussions. We are missing voices at this table right now. We don't have any governments sitting here. We don't have any members of like low middle income countries sitting here, at least not in their like government representation. We don't have any patients sitting here at the moment. So how do we bring the right voices into the right discussions? And then lastly, training and careers. We need more in education of students, of residents, of nurses, of everybody in the healthcare sector, and then also of the general public to understand what are the gaps, what are the needs, but also how can they be supportive of their own health.
Yeah, absolutely. So bring the entire ecosystem together so that the solutions are co-created to fit the actual needs. Bernadette, given the WHO's pivotal role in global health, can you highlight some of the critical gaps that you have identified, and how do you envision overcoming these barriers to advance health for all?
So I think we've already covered one of the big barriers is actually reaching those underserved populations, and it's a challenge. And it's a challenge for reaching them with medicines. It's a challenge for increasing knowledge. It's those social determinants that we were talking about earlier. But there's progress, and it's good progress. We're working together with partners, multiple partners, on supply chains, on building that capacity. One thing that neglected tropical diseases share is weak data. It's not often these diseases are not part of the formal surveillance system. And so we are working with very little in our hands. When you start talking about burden of disease studies, well, when you look at the studies, most of them are modeled studies and they come up with an estimate. And why do we have estimates? Because we don't have data. So there's a lot of work still to be done around data, and that will help us also make the case, because with data we can monitor, we can show what we can evaluate what we're doing, and we can motivate our politicians and our governments to invest more and to contribute more. And I think an area where we could be doing more is engaging with the parliamentarians, which we perhaps on the subject of neglected tropical diseases in many of the endemic countries perhaps are not as active on. So those are a few things. I think there are easy fixes, sort of, easy. Then one thing, of course, I am working on the zoonotic diseases, the animal-human interface, environmental interface of the neglected tropical diseases. And if we could focus more on prevention, we could have a much bigger impact and we could have more sustainable results. Because if we can reduce the risk at source, then we will also reduce the risk of people's exposures to these microorganisms or other health risks. And so if you're familiar with One Health approach, we now have the human health sector more or less here, but we also need to be engaging with the animal health sector so that powerful interventions, and again, I'm biased, I run the rabies program, snake bite program. You know, if we could be working, using a vaccine for a dog, well, it could save the lives of children, but we're not doing it at scale. We're lucky that we have a Gavi investment currently, so it will bring the others together. So one investment will leverage another and will start putting momentum to a clockwork. And I think this is really important as partners. So as we move forward, as I said, we categorize about 21 neglected tropical disease risks. They're not equitably resourced, so some move faster than others. And so I think there is still a lot of scope to be thinking in more of a comorbidity, looking at where can we integrate best. It doesn't have to be everything only where it makes sense, but I think there's still a lot of space where we can leverage what is being done currently in communities and at every level of the health chain to work more closely together, coordinate and collaborate. We want a well-tuned orchestra. If we are all playing in our own way without any consideration of others, we'll have a cacophony. And we've experienced that, but I think we're getting better at our orchestra and we need to do it more.
Yeah, I like the metaphor of the orchestra of everyone working together in harmony, which is also what Maria Rosa had mentioned before. So, Jay, in observing what healthcare companies and multi-stakeholders are for the ATM index, but also beyond that, what are the main gaps that you foresee, and what do you advise companies to focus on and prioritize to enhance patient reach and impact?
Sure, and I'm going to take Micah's cue and try to position it more as opportunities to keep an eye out for and where you can partner and act. I think one is the priorities for research and development are very clearly identified by WHO and other organizations like Policy Cures Research. And yet we only see about 8 out of the 20 pharmaceutical companies even active in some of these priorities in the past years itself. So making sure that we're leveraging the power of biotechs, the power of partners to really help to scale things up when you don't have enough of the pharmaceutical industry investing in research and development is an important way to tackle some of these research and development gaps. Second is on access planning. I mean, at the end, you don't want to have populations around the world waiting 20 years to get access to something that is available in some part of the world. So that early access planning and the foresight where people are aware of what innovations are soon going to be entering the market and being able to ask the right way, I think would be important. As was already mentioned earlier, the current access is really heavily reliant on donor funding. And yes, there's more money available to invest and to both philanthropic and in impact investment funding available to invest in healthcare. So we need to leverage that for more causes so that the existing partnerships are continued. There's hardly a lot of initiatives working in non-communicable diseases, which is where we really need partners to really step up and utilize both existing mechanisms and start building creative mechanisms there. In the last few years, we've also seen a number of, due to either financial or strategic choices, many pharmaceutical companies have also exiting markets, and still having some companies still have sort of US and Europe first as the way that they enter into access issues itself, knowing that there are domestic problems on health equity. So really paying attention to solutions that prevent the damage of these exits, so patients actually have access to treatments using distribution-based models, having better data on procurement, having better data on consumption rates, I think really help in understanding how to solve some of these issues itself. At the end, I think there's still a number of companies and their investors that believe that the profit margins need to be a particular size. So we do need to have more companies realizing that you need a different type of model in order to serve markets globally and make that level of impact and keep motivated staff on board and attract more motivated staff on board. So the rise of different types of business models that embed access and health equity, I think, will be something to keep an eye out for and partner with. I think the last thing is at the end, politics and changes of leadership affect access a lot. So it might be a group that actually agreed to sign on an agreement and work on progress, but at the end it might be a different group that actually needs to deliver on it further downstream. And we've seen that with policies on women's healthcare in political settings, but I've also seen that when changes of leaderships happen in pharmaceutical companies and a great program is stopped or a new program is started, but it might last only the lifetime of that company's leadership time frame. So really embedding access in such a way that it is immune to changes in people and personnel, and really embedded in a corporate culture, in an organization's culture, in a government system, I think would really make a big difference in it. But I'm encouraged by the fact that there's now a lot of new things that are emerging: better data, better utilization of data, more awareness of the situation, more investment into healthcare. So this is not the moment to stop and worry about all the gaps, but it's the moment to start acting on them.
Well, thank you for ending that on a really positive note. Now, as we conclude this discussion on how to advance health equity, if you could, each of you, in 30 seconds or less, tell us what immediate action or commitment do each of you believe is essential for stakeholders to undertake right now? Maria Rosa.
Well, if I think about the metrics and the Coalition on Reproductive Justice, really having companies championing the metrics, for sure. So that's a call to action.
Thank you. Micah?
Yeah, I would say let's speak up, speak out, and let's put both our money and our mouth where the data is, and most importantly, where the women themselves are.
Okay. Bernadette?
So as partners, we are accountable and we should see where we add the most value. And so together we should also, with health risks that might not be at the top of the priorities, maintain also that research and development going so that we have tools available for us in the future as well. Thank you.
Klaus?
We'll see the SDG stock taking early next year. So I think we are all invited to be brutally honest about where we are, what we've been able to achieve, but also where the gaps are, and to make the commitments needed to close the gaps we will actually see when we do the stock taking. So we have all hands on deck, but we also need to accelerate as a company on some of our goals.
Thank you. Jay?
I think it's in keeping the most vulnerable populations as the center of whatever someone is doing, right? So to make sure that you persevere in these partnerships and you deliver on the initial ambition that you have, or the renewed ambition that you have, but really delivering on it while keeping that accountability to the most vulnerable populations that rely on it.
Well, thank you so much, everyone, for joining this panel, and also to the panelists, Jay Iyer, CEO of the Access to Medicine Foundation, Maria Rosa, Chief Private Sector and Civil Society Branch at the UNFPA, Micah Sharp, Deputy Director Foundation Strategy at the Gates Foundation, Bernadette Abela, Team Leader of Control of Neglected Tropical Disease at the WHO, and Klaus Runge, Chief Health Equity Officer at Bayer Pharma. Thanks, everyone. Thank you.
Thank you.
Thank you so much.